Now, after Mr. Tolga, I ask you to give your talk after the good presentation yesterday about ozone therapy, and you try to complete in the application in the urology field.
Bonjour. Bonjour. Oui. Merci beaucoup. Bonjour, mesdames et messieurs. We have one madam here today. Yesterday I didn't find them. That's why I didn't tell the mesdames et messieurs yesterday. Let's start with pelvic pain. As you know, I am an anesthesiologist and intensive care unit specialist. I'm working on the pain more than 10 years, especially I'm focused on the diagnostic and the interventional procedures with ultrasound. Of course, I use in my daily practice C-arm fluoroscopy as well. So in this presentation, I'm going to focus on what kind of interventional procedure that I use in my daily practice for the pelvic pain, especially ultrasound-guided procedures. After excellent video presentation, I just have some illustrations about how can we find most important nerves on, yep, great, yeah, this is me, yeah. So, I'm gonna check over there. Of course, we'll mention about how can we use ozone, medical ozone. When I call that ozone, I mean medical ozone. As you know, there are many types of ozone in industrial side as well. You can disinfect water, you can disinfect air. That's why when I talk about ozone, I mean medical ozone therapy. So let's look about the pain in pelvic area. So the pelvic pain usually comes to repetitive microtrauma to myofascial area. That's why we use a trigger point injection for this. It's very simple, and of course, it's beneficial, and the most the pain comes to repetitive trauma to myofascial plane. That's why we use ultrasound and ultrasound-guided procedures for the myofascial pain comes from the pelvic area. The trigger point injection, we can use corticosteroid, of course, but in my daily practice, I use ozone injection for the trigger point area under ultrasound guidance. And we use nerve blocks and the plexus blocks as well. As you know, the pelvic pains comes the nerve entrapment pathologies as well. Of course, sometimes we came across the plexus pathologies. Sometimes endometriosis or endometrioma push and press to the plexus of the lumbar or sacral area. That's why we came across this patient with pelvic pain. And the neuromodulation is another method of treating the pelvic pain. And it's very high technology side of the treatment, the pelvic pain. And the pelvic myofascial pain comes from these muscles. You can see the muscle names here. And of course, I use ultrasound for performing my procedure. And of course, I use ozone, but for pelvic pain, we use ganglion impact block. It's very common and it's very important ganglion for us treating the pelvic pain. And other plexus block is superior hypogastric plexus block. These two blocks can be performed under C-arm fluoroscopy. You cannot use ultrasound for this block. Not only block, sometimes we use radiofrequency ablation or chemical ablation, like alcohol, like a phenol injection to the ganglion impar or the superior hypogastric plexus. The chemical denervation and the radiofrequency ablation gives us the long-term pain palliation. But we need to see fluoroscopic guidance. and the ozone will not work there. Ozone work with the nerve entrapment as well. So just give a simple nerves route that we can use ultrasound and ultrasound guided dissection. What means the dissection? Hydrodissection we use under ultrasound guidance for rescue the nerve under entrapment. You know, the lumbar plexus nerves are very important for the pelvic pain. These nerves come from the lumbar plexus. You can see the names of nerves, and I'm going to show the place. But another important nerve, the pudendal nerve, comes to the sacral plexus. So another three important nerves are cranial nerves, superior, medial, and the inferior cranial nerves are include the pain above the pelvic area. The neuromodulation process can be performed for pain treatment or pain palliation above the pelvic area. These are very high technology procedures. If you select your patient for the neuromodulation, not all the patients aim to neuromodulation. You have to select precisely your patient for neuromodulation. In my daily practice, look at this illustration. I explain easily some sonar anatomy and transducer position on the patient. I prepared the illustrations. When you put your transducer over the skin, like this angle, over the inguinal ligament, you can easily find the three different muscles which help us to finding two important nerves. As you know, the ultrasound beams cut the tissue like a knife. When ultrasound beams cut the tissue like a knife, what we're gonna see on sonogram? Of course, we can see the axial view. Your transducer should be like this, okay? And you can easily identify the three layers of the muscle: external oblique, internal oblique, and the transverse abdominis. This is your sonogram. You can see the anterior superior iliac spine, hyperechogenic line. Easily you can find, because all of you use ultrasound in your daily practice. I assume that. So this is transverse abdominis and the internal oblique and the external oblique. Easily you can find intersection of this muscle between this fascial layer, ilioinguinal, and the other nerve which is important for the pelvic pain, the epigastric. You can do your procedure medial to lateral approach. Just you can use spinal needle, or if you want to use neurostimulation needle to find the nerve, and just hydrodissect this plane and give you local anesthetic agent and corticosteroid here. Okay. You see the nerves? It's easy to find them. They are tiny nerves, but this is interfacial plane nerves. You don't need to find exactly to the nerve. Put your needle interfacial plane and do your hydrodissection. Hydrodissection means giving or 5-point dextrose or saline combining with local anesthetic agent or corticosteroid and dissect along to the interfacial plane and covering this solution to heal the entrapment neuropathies. But I'm going to talk about today not hydrodissection. I use dry dissection. What doesn't mean dry dissection? As you know, ozone is a gas. That's why I call that dry dissection. Just put your needle into the fascial plane and just dissect this plane with ozone. 10 milliliter ozone, 10 microgram per milliliter concentration is enough for dissection. And the ozone cover the nerves, and they elevate to the anti-inflammatory effect and the rescue to the entrapment. So another important nerve is the genitofemoral nerve. When you put your transducer axial plane and find the femoral artery, turn your transducer almost 90 degrees and move your transducer to the proximally and find the external iliac artery like this. And in the genitofemoral nerve, especially the genital branch, entrap over there. If the patient has a story of the operation, the inguinal surgery, if the surgeon used to the mesh, unfortunately, this nerve entrap over there. And we can do hydrodissection. In my daily practice, I use ozone dissection as well. It's easy to find this nerve. You can do your procedure out of plane technique. What doesn't mean out of plane? Probably you know the out of plane technique. This is out of plane technique. Your transducer beams goes directly to the anatomic structures, but your needle is perpendicular to your transducer. This is out of plane technique, you know. If your transducer parallel to your needle, it's in plane technique. Most important nerve is pudendal nerve for the pudendal neuralgia. The key point of the pelvic pain. As you know, the pudendal nerve is a mixed nerve, but usually carry on the sensory fiber, and it's responsible to do sensorial innervation. But we have to think that there is a motor innervation as well. It's come from the sacral plexus, and she entrap. Well, I call that the nerve she, because I believe that the nerves are female. They are very gentle, they are very naive. That's why we have to be kind to nerve. We shouldn't run into nerve. We have to be kind to them when we are performing hydrodissection. Even though when we are doing dry dissection, we shouldn't touch the nerve with our needle or cannula. So, this is anatomy of the pudendal nerve. It's very important because usually the pudendal nerve entrap to two different between the two different ligaments, sacrotuberous and the sacrococcygeal ligament. In my daily practice, I do my hydrodissection or dry dissection in prone position because my approach is a posterior approach. The gynecologists do this procedure in gynecologic position usually. I don't know, you are doing this pudendal nerve entrapment injection in your daily practice or not. You have experience about the pudendal nerve neuralgia. It's very common, unfortunately, and neglected, unfortunately. Usually entrap the posterior side. That's why I do my procedure on prone position. Okay, so this is a run course of the pudendal nerve. She has a tree branch, but the main entrapment area is between the sacrotuberous and the sacrospinous ligament. And as you know, the pudendal canal is very important anatomic structures for the pudendal nerve. She accompanied with the internal pudendal artery and the internal pudendal vein. And it's not easy to find the pudendal neuralgia symptom. We need to anamnese, we need to physical examination. Sometimes we need the EMG, but there are some criteria, the non-test criteria about the pudendal neuralgia. It's not only for women, it's also for male pathology. And there are essential criteria and the complementary criteria you can find easily here. After the diagnosis, you have to be sure there is a pudendal nerve entrapment over there. You can do your diagnostic block You can do your diagnostic block under ultrasound guidance. You don't need to use CM fluoroscopy for this diagnostic block. If you use corticosteroid with local anesthetic agent for your diagnostic block, probably after the procedure, when the neuropathic pain goes and they heal, this is not only diagnosed, this is treatment as well. But sometimes you cannot use corticosteroid for your patient. You can use ozone dissection, dry dissection. When we exclude the external superficial anatomic structures, I'm going to show again the pudendal nerve. When you put your transducer, this transducer angle and the position, real position. I drive myself my transducer three-dimensionally, and every time I change my transducer position in my picture and video. When we put our transducer exactly like this, we can identify the important anatomic structures: internal pudendal artery, sacrospinous ligament, and the sacrotuberous ligament. If you find the two ligaments, the nerve is between to this ligament. You cannot see every time the pudendal nerve exactly. Look at this posterior approach. When you put your transducer here like this is the axial plane view. Of course, your transducer brings up the tissue like a knife. And what we're gonna see here, it's easy way to understanding the ultrasound guided procedures. When the transducer cut anatomic structures, your sonogram, of course, you have to use curved linear transducer. The linear transducer is not enough for deep structures. Probably you use in your daily practice curved transducer. Linear is not help for this block. This is our sonogram. Look at this sonogram, exactly match to the illustrations. You have to move your transducer to the distally, like this, and your transducer right now exactly two plane to two different ligaments. Of course, your transducer beams cut the tissue like a knife, and what we're gonna see over there, come here, okay. This is a sciatic nerve, this side is sciatic nerve, and other one is the pudendal nerve with the accompanying artery. I told you yesterday, arteries are male and the nerves are female. They love each other. If you find somewhere artery, probably the nerve accompany with him. Yes, this is an illustration, exactly match my sonogram. This is a ligament, another ligament. You can find here the sciatic nerve and here pudendal nerve. You can do your procedure at this level, but I don't prefer this level because when I do my procedure at this level, it's very close to sciatic nerve and the pudendal nerve. I don't want to my local anesthetic spread to the sciatic nerve. Even though the low concentration local anesthetic, when they cover sciatic nerve, the patient will have some problem about the covering the local anesthetic sciatic nerve. That's why I usually use another approach, move your transducer more distally and find the canal, alcove canal, and the sciatic nerve and the pudendal nerve far away them. Look at this, axial view. The sciatic nerve is here and the pudendal nerve is here. That's why there is a bone intersection. It's not easy to spread your local anesthetic agent. If you use ozone, there is no problem about the neuropathic pathologies, or because the ozone has no any local anesthetic effect. You can use ozone easily and safely here. Of course, you can do your procedure medial to lateral approach in plane. This is a sciatic nerve, this is a pudendal nerve. There's a bone here, that's why it's safer than other approach. Medial to lateral. Okay, I call that hydrodissection, but I'm using in my daily practice dry dissection. Why I call that? Because ozone is a gas. Just we need a perineural ozone dissection, 10 or 50, 10, not much more than 20, not much more than 20. 10 is the best perineural injection concentration for the nerve. You can dissect not only pudendal nerve or not only ilioinguinal nerve. You can dissect every nerve. For the carpal tunnel injection, for the cubital tunnel injection, you can use ozone for perineurally. We can use anti-inflammatory effect and dissecting the entrapment area for rescue the nerve. Okay, this is my patient. This is another example about dry dissection. My transducer position here, this is a sural nerve. Do you see the sural nerve? Yeah. It's almost 1.4 millimeter diameter. It's a small nerve. And you can see my needle. Do you see my needle? This is a blind needle. I use neurostimulation needle because it's not sharp needle, blind needle. The needle diameter is almost 0.4 millimeter. I have hearing loss? Oh yeah, come back. Okay. It's 0.4 millimeter. It's very tiny, my needle. And my needle is almost touch the nerve, but never run into nerve. My needle tip is into the perineural space. Please, carefully watch this. Do you see my needle? And up. Again. This is ozone hydrodissection. Do you see the ozone hydrodissect along the nerve, immediately spread, and in a second start anti-inflammatory effect. It's very effective and there is no side effect. Just you need to put your needle through place. Again. Dissect along the nerve. Okay, let's talk about another application way of the ozone for the pelvic pain. There are many articles you can find easily in PubMed or Google Scholar. And one of the articles, I really like it. It's about intravesical application of the ozone for treating to interstitial cystitis. There are two different articles, but many of the authors are same. They use the intravesical ozone. This is another article, but it's another journal as well. But this almost same the authors. Okay, so they use treating to ozone for interstitial cystitis. And of course, they scoring to do some important scores. And the conclusion, they conclude that this is a preliminary investigation, but they use the ozone treatment without any side effect. And they believe that the ozone is, can be powerful treatment for the future for this main pathology. And there are many articles. One of the article about the ozone therapy in the chronic pain. This is a retrospective analysis, a multicentric study. They use ozonate water and the directly ozone oxygen mixture intraperitoneally for treating to the pelvic pain. They use different concentration ozonate water and different concentration ozone oxygen for treating the pelvic pain intraperitoneally. Another case study from New Zealand, they use for treating the helped therapies for the radiation therapy in the prostate cancer patient. Yesterday we mentioned about the ozone therapy for the cancer patient. It's a tricky issue, but we know that the chemotherapy has many side effects. We can prevent the patient side effect of the chemotherapy. At that time, we have to choose the true timing before the chemotherapy and after the chemotherapy. We can prevent the patient with ozone therapy, the vomiting, and some neuropathic change, the side effect of the chemotherapy. Of course, we can use rectal insufflation as a rectal insufflation to many complications about radiotherapy as well. And they conclude that they can prevent radiotherapeutic side effect with ozone therapy. Rectal insufflation, not only way of the preventing the radiotherapeutic agent to the rectal side for prostate cancer. We can use ozonate cream as well. But the concentration of the ozonate cream and the concentration of the ozonate water should be arranged properly. Ozonate water, just we need the ozone generator and the specific gadget for the ozonate pure water. We use bidistillate water for ozonate, ozonization procedure. Just 5 or 10 minutes, 19 or 100 microgram per milliliter concentration dive into bidistillate water, and you can reach almost 20 microgram per milliliter ozonate water. It's not easy to calculate exact concentration, but almost the concentration and the timing gives us 20 microgram per milliliter ozonate water. We can use intravesically. We can drink it for gastric some problem as well, and we can use intraperitoneally. The rat studies usually do intraperitoneally. But we have to know this is not main therapy. This is just helping therapy. This is just complementary therapy. And the patient should know that this is just complementary therapy. They should continue the radiotherapy as well. They should continue the chemotherapy as well. Okay. And another study about the endometrial injury, they do the artificial endometrial injury and endometrial infection for the PID, reaching the PID to rats, and after they treat with intrauterine ozone treatment. And they, of course, they use ultrasound examining the PID level. They use levofloxacin for treatment, and they use 45 and 60 microgram per milliliter ozone concentration. And you can easily see the difference of the sonogram, the three group. Of course, they do some histopathologic study in this article. You can see the change with the 45 and 60 group and the antibody therapy group. And they conclude that ozone is effective in the PID treatment, especially when they use the intrauterine area. And the chronic interstitial cystitis therapies with ozone can be possible, intravesical ozone or directly insufflation to the ozone-oxygen mixture can help to alleviate this pathology. And there are many articles you can find easily to them. And ozone therapy is a promise to good feature for helping to treat many pathologies, especially the pelvic pain. Thank you so much for your time. If you have a question, if I know something, I would like to answer you. Thank you.
Thanks, Dr. Tolga, for this excellent presentation. My question is, do you have any experience in use in the urinary tract infection that are multi-resistant to the antibiotic?
Sorry?
This infection with the multi-resistant bacteria, ozone therapy, antiphysical for
which?
UTI.
PID, for PID? Or?
No, for urinary tract infection.
Okay.
Multi-resistant. With no antibiotic, no choice. No,
No
we
choice.
have
Okay.
reached the end.
Okay. We have many different centers with dedicated ozone. One of the center we work together in Italy with rheumatologists. And we work with another center in my country. The antibiotic resistant bacteria or intra-articular infection we came across, unfortunately, usually the intra-articular antibiotic resistance bacterial infection. Yes, of course, we have some real pain in the ass problem with the urogynecologic infection, multi-resistant agent. At that time, we have to use ozone therapy, two different approach. Always we have to add major autohematherapy because it's a systemic way of the ozone therapy, and we need to use where is the bacteria. If into the joint, we can directly do your injection into joint. If there is a bladder infection, urinary infection, you can directly inject intravesical into bladder area, ozonated water, or directly ozone-oxygen combination. But you have to add major autohematherapy, systemic way. If there is no any major autohematherapy chance, such as some favism or some the peripheral venous discomfort, you can use rectal ozone systematically. But one session or two sessions is not enough. After the application, we have to repeat the procedure again and again, and we need to get a culture, we need to get a sample and send to them to laboratory, the infection relieve or not. It's not easy to help only ozone. Ozone just help to them. But we have many patients, especially intra-articular septic arthritis, treated with only ozone. If there is no osteomyelitis, we need to combine major and locally injection together.
Thank you for your presentation. I don't understand something about technique. When you do hydrodilation.
Hydrodilation. Right, yes.
It's improve visibility. But
dry dissection or hydrodissection?
No, hydrodissection.
Hydrodissection. Yeah.
When you do dry dissection, you create the screen between the nerve and the probe. Okay?
You mean gas is unfortunately disturb your ultrasound image? You mean that?
Yes.
So how could it be possible? When I started dry dissection, my colleagues asked Tolga, the main two limitation ultrasound, gas and the bone. How could it be possible dry dissection? I give to them some secret. The first injection site should be deep to superficial, and the injection site should be distal to proximal. If you do this, you can see everything clearly. Please remember my perineural injection. I do this injection superficial side of the nerve, but you can continue to see the profundus side of the nerve. Do you remember? Even though I inject my ozone superficial side of the above to nerve, you can easily see the below to nerve and other structures.
But we have a shadow line.
Shadow line, yes, but we can continue to see under the nerve. You have to do your first injection deeply, start injection to deeply to the superficial side, and do your first injection to the distally, start to distally to proximally. Usually I do dry dissection. I start with dry dissection, just small amount of liquid for opening to my space, just 0.5 milliliter dextrose or 0.5 milliliter saline solution. I always want to be sure my needle tip is right place, and I want to just expand to the area for the gas. At this time, I directly use ozone. I didn't use a small amount of fluid for dissecting because I'm really sure of my needle tip. This is a just technique, implant technique. Even though you use gas, you can see the below to the nerve, below to the other structures. There are just 2 or 3 tricks. If you can use, you can see easily.
I have a technical question. So have you ever seen a gas embolism like in the divers?
Good, excellent. The gas embolism about ozone reported just 1 or 2 cases in the literature, but this is only false in structure. Of course, you can do directly intraarterally, intravenous injection to ozone. The embolism of the gas can be possible, but if you do your procedure under ultrasound guidance, if you do your procedure under any an example, CM fluoroscopy, but you need the contrast agent for see the artery and the vein circulation. In my daily practice, I use ultrasound for my ozone injection always. That's why I never came across. It's very rare. This is just technical, instructional. It's not complication. It's malpractice. It's malpractice. It's not complication. It's dependent on the doctor.
In the literature, is there a very rare and very serious accident about that?
Yes, the one case about the vaginal insufflation. We use vaginal insufflation ozone because you know that after the antibiotic therapy, the vaginal candidiasis sometimes really bad hectic problem. Even though they use ovule and or systemic antibiotic therapy, sometimes we cannot eradicate the candida, vaginal candidiasis. That's why we can use vaginal insufflation, ozone insufflation for treatment of candidiasis. I have never seen before, there is no any treatment about the vaginal candidiasis when we use ozone. After the first or second session, the candidiasis symptoms goes because ozone in many concentration, antibiotic effect has an antibiotic effect, antiviral effect, and antifungal effect. It's dependent on concentration. If we give positive pressure speedily, okay, the gas embolism can be malpractice. And we have, unfortunately, one case, intradiscal cervical ozone injection. After the cervical intradiscal ozone injection, sometimes the disc, the secreted disc, the gas leakage to the epidural side at the cervical or lumbar area and goes directly to the brain. The patient had a pneumocephaly. But this is another, it's not complication, this is malpractice. Yeah, you shouldn't do the sequestered intradiscal ozone. This is a wrong choice. Ozone should be chosen to the right patient, to the right indication. Ozone is not magic. You cannot use every circumstances. You cannot use every patient. You have to choose your patient properly. You have to choose ozone concentration properly. You're welcome.
Please, do you think that the urologists can do this alone? We can ask help for radiologists because the repair of nerve are difficult. You don't think that a radiologist can be helpful for us?
For intradiscal procedures,
Yes.
every intradiscal procedures we have MRI and investigation to the patient. In my country, the intradiscal procedure can be performed by usually pain physiatrist and other modality. The radiologists in my country don't willing to doing interventional procedures. They just focus on the diagnostic purposes. Unfortunately, we really love to work with the radiologist because even though they don't have any competency about musculoskeletal system radiology, because they focus on the abdominal, thyroid, and other MRI pathologies, but the ultrasound and musculoskeletal system is very different, need a very different competency. It takes time. It's a steep angle, gain the competency, but it's possible. Just radiologists need to interest this area. Maybe they have no time.
We have a question from the floor, Professor Rabia.
Yes, I have a question about, I use carboxytherapy for many urologic diseases. What about you, for your opinion for carboxytherapy? Because I see the same carboxytherapy or dioxide carbon, you can do it in many diseases, erectile dysfunction, for vaginal, also for pain, for many things. What do your opinion for this carboxytherapy?
Carboxytherapy.
Yes.
Carboxytherapy is not popular in my country, but many friends, especially Greece, they work on carboxytherapy. I have no any experience about the carboxytherapy. I really interested to this therapy, but I have no any experience. I'm gonna learn one day, and maybe we can talk about this therapy in detail. Thank you.
Just a comment. What do you think about ozone therapy and hyperbar therapy physiology?
Okay.
Because it's the
Is-
same.
These are even though these are different modality, but many pathology can be treated both of them. But we have known about the sensorial hearing loss. For the sensorial hearing loss, if the sensorial hearing loss is dependent on the neural structures, is the neurosensorial hearing loss, the treatment of the hyperbaric and the medical ozone is same and equal as much as has a benefit same, but the cost effectivity is different. For the hyperbaric oxygen therapy, you need a spatial chamber, you need the extra specialty, you need the environment, and it's not cheap therapy. But the ozone
easy to
therapy,
do.
of course, ozone therapy, you just need your some generator and oxygen. It's very cheap therapy if you compare with the other one. But I don't mean every pathology can be treated both of them. No. An example, if you dive into deep and you have some nitrous oxide pathology, you have to go to chamber, of course.
Thank you.
Thank you, Dr. Olga. Pelvic pain is one of the most hard situations to treat. And these patients suffer a lot because there is no miraculous treatment. And my question is about ozone therapy. Why ozone therapy is not recognized by learned societies? Because I revised last EIE guidelines about pelvic pain. There is no mention of ozone therapy. Is it because studies are not so strong. What do you think about it?
You mean why the guidelines not include the ozone
Yeah,
therapy in,
yeah, that's my
in
question.
there? Okay, we need to ask to them, society, why don't know ozone therapy and why don't include their guideline? I'm really curious. Probably the main reason about ozone therapy is effective and cheap. The problem is cheap. For one session PRP in my country, just one session PRP, the patient pay almost $100. One session. They needed 3 sessions. They give almost $300 or euro. It's same. But on the other side, the ozone is just for one session, $10. $10. Is this your question's answer?
Yes. But I think studies are not so strong yet.
Strong studies. You can find many strong studies. I really
There
like
are
the
no
animal studies.
randomized prospective studies and comparative studies with other.
Yes. Okay. We have many randomized control study in our country, Turkey, because we have another ethic committee for the ozonotherapy and acupuncture and other complementary therapy. Many countries has no different local ethic committee for the ozonotherapy or acupuncture. The same local ethic committees are give to permission to many randomized control study. But in my country, for more than 5 years, we have separate ethic committee. That's why we can do easily randomized control trial with ozone. If you notice that the many study comes from the Turkey, Latin America, Turkey, Italy, and Russia. Russia used for many years. In Turkey, we just used 25, 30 years ozone, but the Russia used more than 30 years maybe. And the Latin America use regularly ozone therapy. Many Latin American country, not every country, and they covered by government formally. It's just dependent on your country, dependent on medical insurance status. Thank you so much. Thank you so much. Turkey, not Turkey.